Hey everybody, welcome back. Movement Doctor, Dr. Drew with Motor Specialist Physiotherapy. And on this series, we're going on Google versus the Movement Doctor. And we're gonna be talking more about what to do and how to handle pulled hamstring. All right, so now what we're gonna be talking about is a pulled hamstring or a hamstring strain. Now, typically you'll see this at high loads, athletes kind of running a lot, whether you're a track athlete or a wide receiver for a football team. Whatever it may be, you may have come across a hamstring strain. Now, one of the things that we always tell people when they get a hamstring strain is don't stretch it. So you definitely don't want to stretch something that's already pulled. So if the fibers are originally like this and then you pull a hamstring, by stretching it, you're actually pulling it a little bit more. What we want is that to actually heal. So first thing is kind of don't stretch it, and then go to our MEAT principle that we've talked about before, where it's movement, exercise, analgesics, and treatment. Now, people always ask, well, how do we prevent these hamstring injuries from happening? Now, there's a few different things. A lot of people have different scenarios on what they think is the culprit. So one of the key things that we've seen that causes hamstring injuries is that the pelvis is actually too much rotated. Specifically, the ASIS is anteriorly rotated. So by anterior rotating the pelvis too much, or someone does have too much anterior rotation here, anterior pelvic tilt, the hamstring now is on a greater length. So if the pelvis is anterior rotated too much, the hamstring runs from the ischial tuberosity down to the behind, lower past the knee. So what we want, if this is too anterior rotated, if the string was connected here to there, it would be on a higher length tension ratio, which then will cause the hamstring to be on increased tension whenever our leg is now pulled forward like this. Another key thing that may be causing a hamstring injury is that eccentrically the hamstring cannot manage the load. So every time when we're running here, the hamstring has to eccentrically contract, but right before our foot hits the ground. Now, this becomes a problem if you don't have that eccentric strength here. And people, when they say they feel like they tore their hamstring, is they say they feel it mainly right when they make contact. But typically, it's happening right before, and then when they make contact, they actually feel it. So we've seen this a lot. When you're getting someone back from a hamstring injury, you really want to specifically train the hamstring eccentrically, meaning the negative side of the way the muscle contracts. Not so much always concentrically by pulling the hamstring in, but also pulling the hamstring out and you're controlling it. So you really want to focus in on the quadriceps shortening, making the hamstring more lengthening. So now when we're talking about treatment of the hamstring injury as well, when we talked about using the MEAT principle, you want to think of an active stretch, meaning you want the quadriceps to actually contract to give your hamstrings an active stretch just until it's pain-free. There should be no passive stretching again for the hamstring, but more of an active assisted stretch, mainly using the antagonist muscle, in this case the quadriceps, which is the antagonist for the hamstring. And this kind of works for any kind of muscle strain. You always want to train the antagonist to help with the healing of the agonist muscle that was injured. Please don't forget to like, drop a little comment, and subscribe to our channel for more great content.